My name is Dr. Candace Boyer, and I am the Medical Director of Lancaster County Osteopathic and Integrative Health, or LCIH for short. I am board certified in two things: neuromusculoskeletal medicine and osteopathic manipulative medicine. That's the hands-on stuff that we'll talk about in another video. But the second thing that I am board certified in and am very passionate about is integrative medicine. So what is integrative medicine? Well, let me tell you what it's not. The normal medical paradigm for health in our country is broken down into systems. Based upon symptoms that you have, we, as our medical knowledge teaches us, to tag that with an organ, give it a diagnosis, and that's what the focus is of the medical paradigm for healthcare in our country. Basically, come up with a diagnosis, and if you don't have these four things, it's not that diagnosis. And we won't treat you until you have these four things and that diagnosis. Many of the treatments are based upon band-aiding or decreasing the symptoms. Integrative medicine is a way of helping patients, coming alongside of them, giving them the tools they need, but then us as the healthcare provider using whatever tools it may be, whether it is lifestyle, medication, supplements, food, we can use all of that. The main premise of integrative medicine, though, at the root of it, is finding the root cause. So just to give you an idea, the general medical mantra would be, okay, you have inflammation in your joints, we'll call that arthritis, and we'll send you to the rheumatologist. You have inflammation in your liver, we'll call that hepatitis, and we'll send you to the GI doc. You have inflammation of the gut, you have IBS or irritable bowel syndrome, and we'll send you to the GI doc. Inflammation of the brain, we'll call that ADHD. If you're a child, we'll call it depression, anxiety as an adult or a child. And if you have it long enough, it'll be dementia. And so they split that up. In the integrative medicine model, our goal is to decrease that inflammation, but then find out where it's coming from and heal it, get at the root cause of that so that all of those systems can heal and your body as a whole can heal. In integrative medicine, we believe that 75% of chronic illness is preventable. In other words, 75% of chronic illness is determined by what we put in our mouth, what we put in our mind, and how we move our body. 25% you can't really do a whole lot about, but that's really, really good news. That means that if you have a chronic illness, 75% chance that you could do something, little change in your lifestyle or what you're doing to make a huge difference and to heal from that chronic illness. So that's my take on integrative medicine. I'll have another video later about the differences between integrative medicine and functional medicine because that's a big thing right now. In my mind, I don't see them as a whole lot of difference. But suffice it to say, I am board certified in integrative medicine, and that's kind of my take and my definition of what integrative medicine means to me and how we implement it and apply it at LCIH.